The Community Health Center movement started in 1966 at Columbia Point and the housing project in Columbia Point by Dr. Geiger and Dr. Gibson. So that movement started by concerned people wanting to make sure that there was access to care besides the emergency room for people who had no other means for care. Studies have shown, for instance, the George Washington School of Public Health and Public Health Services commissioned a study that found that community health centers are proving to produce as good, if not better, health outcomes as hospitals and private physicians' offices. And when you roll up that data from across the country, it explains why the federal government puts money into community health centers, because they're effective at producing good quality results.
We have a patient that started out in House Neck with us when House Neck first opened. She's mildly retarded. She's now in her 50s. She's a person that you would probably want to rush through a visit because she can be demanding at times and things like that. But we had a good physician's assistant that was able to work with her. And over the course of all this time, we have found out that she's a diabetic. In addition to her mildly retarded condition, she also has a severe heart condition that we discovered, and she's actually had angioplasty and all this stuff. This is a woman that would have died without somebody taking the time. She calls 2 or 3 times a week just to talk because she's lonely, and you know this. So you take the time with her. She knows all of us by our names, and we see her. Sometimes we see her, she walks over from Work Inc., so sometimes we just see her and put a Band-Aid on what she thinks is a cut. But it's the socialization, it's that connectiveness that keeps her going through us. You know, when we manage her diabetes, and you know, she's alive because of us. One of the biggest things that I see that patients are having a problem with is the co-payments. We have such an increase in telephone calls of people wanting to be treated over the telephone rather than coming into the office because they can't afford the co-pays for their insurance. So they're asking us, you know, can you give me something over the telephone rather than having me come in? It's not always good medicine to try to do that because you can't diagnose over the telephone. So the doctors, if they know the patient, will sometimes say, look, let me give you a few days of this. If you're not feeling any better, you really got to come in because we need to do some tests on you. But it's hard for these people to try to come in. They just can't afford it. You know, we do have some people that are on free care still, that are in the health safety net, that do not have good prescription coverage. You know, we're very fortunate that Stop and Shop is working with us as far as the antibiotics. I mean, they work with everybody, but it's such a great program for our patients because we know they're getting theirs. We know that with the generic program from the different Walmarts, Walgreens, Stop and Shops, they can get that 3-month worth of generic medications for $10. Those are the things that really, really count towards most of our patients.
Is that 3 months for $10? That's not antibiotics? That's
the antibiotics are free.
Okay. And then this would be like blood pressure, certain types of drugs or medications?
Hundreds of medications on this list that if the doctors do prescribe or are able to prescribe the generic form of them, they can get them, you know, for that discount. Well, I think to work in a community health center, that you have to be aware of all the different types of patients that can come through the doors. In a private practice, you can kind of like pick and choose some of the patients you want to take care of. But we have people from such diverse cultures with such diverse problems, and because it's family practice, we see everybody from babies, their families, and growing up, and then as they get older and they can't take care of themselves, we see them too. So it's a wonderful mix of patients from everywhere and from all towns and, as I said, all cultures.